Hello, and I am delighted today to be able to introduce Dr. Lucien to you, and he will tell us a little bit, if you wouldn't mind, about yourself and your work, and the work that you're doing.
Thank you very much. I'm Dr. Lucien Wasingya Kasereka. I'm a general surgeon and a fistula surgeon. I was trained by Dr. Mora Lins in Uganda since 2017. So that since 2015. And I worked with her, and now I'm a fistula surgeon, and she taught me how to do fistula, and she inspired me to continue her legacy and continue helping many women. I created my own charity called the Fistula Program DRC, and I decided to go back home in DRC to start helping many women. And since 2020, I'm in DRC working with a big team, and the charity is now recognized by the government. And we are helping many women with obstetric fistula and other childbirth injuries. And to date, we are up to 1,500 women, and we've treated them for free. And that is our joy, because now we have changed lives of many women, and we still need to do more, because we are having now a big number of new cases in DRC. Because currently, according to the data, we have between 5,000 to 7,000 new cases every year. And we don't have many surgeons who can help women. That is how now we are working hard to train many doctors to prevent fistula and to treat fistula. And to do this work, we need more people on board so that we can work as a team. And for us, this is a big opportunity to work as a team with a safe birth for all, so that we can prevent fistula by doing sensitization, doing mobilization. Because in Africa, many people, they don't know about fistula, and they think that fistula is witchcraft. So that we have to sensitize the community. We have to do radio talks. We have to do outreaches in the community, to do sensitization, so that we can prevent fistula. So that, in brief, this is the work we are doing in DRC.
Well, that is amazing work. It is incredible work that you're doing there. And I know from my own research and from talking to you before that conditions for women, specifically in the Congo region, are not easy. You've said that before, right?
Yes, so that the women, they go through hard life from the delivery, and because we don't have urgent, safe birth, we don't have hospitals, we don't have equipment, we don't have the trained midwives, and we don't have also roads, because to go up to the facilities, they have challenges. And some other areas, we have war, and the women, they have to leave their houses to go and live in the bush, and they can deliver that side, so that they can get many complications, because they don't deliver at the facility, they deliver in the bush and the roads. And at the end, they can even die from there. And only the survivors, we can see them leaking urine. So that now we help those survivors, but many of them, they always lose their lives during the labor.
The other thing that a lot of people don't seem to
Yes.
know is that during an obstructed labor, oftentimes the mother might survive, but the baby would not survive. Is that true too?
Yes, during the difficult labor and difficult time during delivery, most of the women we treat, they always lose their baby, because most of them, they go through labor for 4 days, 2 days, because of the distance or because of lack of the trained doctors or lack of the trained midwives, so that they remain in those small facilities for many days, and they help them to deliver, but without success. And the other aspect is poverty, because they don't have enough money to go for delivery, because even the cost delivery is very expensive, so that it is not easy, and they choose to deliver in small facilities where they don't have even access to safe delivery, so that they end up with childbirth injuries, and especially the young ones, because some of them, they deliver at the young age at 16, 18, and they end up with obstructed labor, and they lose their babies, and sometimes they end up losing their uterus, because they do hysterectomy during the postpartum bleeding, and they end up with leakage of urine, without uterus, and they become miserable. And now our charity always come and reassure these people, treat them for free, and do reintegration, and they come back to the normal life.
You mentioned earlier
Yeah.
that Dr. Moore Lynch, who was an MMM, was very instrumental in your early years, getting you involved in this. Do you think that she helped you see that you don't just treat the wound, but you treat the whole woman, in a girl? You treat the whole patient. In other words, I know you're connected to not just the surgery, but making sure afterwards that they're okay.
Yes, actually, I worked with her. Because I'm following her footsteps, and I understood many aspects, because it is not about treating the fistula like doing surgery, but is about treating the whole of the patient, because she's most of the time the patient is psychologically unstable, and you have to do psychotherapy, you have to do physiotherapy, and still, when you before sending her back home, you have to make sure that you castle also the husband, or you castle the parents, to tell them that this was not witchcraft, this was a disease, and it always happened during delivery, so that they can welcome her very well in the family, because at at the end you may treat her, but they will continue rejecting her, feeling that maybe uh, she's doing witchcraft, and she may kill them, because they always just accuse them. They are stigmatized, they are rejected, and they are isolated from the community. So that you have to work on all those aspects, and inform the family that this was just a disease. But we have a big team. We have our mobilizers and the reintegration officers, who always go up to the community to accompany these women and send them back to the community. And we've made a big team of survivors, and we call them ambassadors. And they are the one even currently helping us to bring more patients to us. And they are always happy with joy, because they were hopeless, and they didn't know how they are going to survive from this. And they come back with hope. And another point, in DRC, we don't have fistula repair centers. We are having 100 million population, but fistula surgeon, they are not more than 20.
Wow.
And they are not in all the country. The country is very big, so that we try to do our best to reach everywhere, so that we can help the one we can help. Even we always pay transport for them. They can travel the whole day, but in very difficult roads, with the area of conflict, but still they always come to us, and we pay back. We pay the transport for them. We give transport refund. Sometimes we pay to and from, so that they can be treated for free.
Well, did you just say that you only have 20 doctors who are trained in fistula surgery then in Congo on a regular basis? There's only 20 trained doctors?
Yes, in the whole country, because some other doctors, they just say they are doing fistula, but according to the data we have, only 20 doctors are active and they can do fistula. And even the fistula repair centers, they are not more than 15, because actually we are working with a fistula foundation to make a fistula treatment network. And currently in DRC, we are less than 15. And we are among the pioneers of fistula, and because we are the one doing a big number of fistula, because we are doing routine every day.
Yes, I know that in some parts of Africa, there's only camps where people are coming in, the surgeons are coming in, and then there's a team of doctors and they perform as many as they can, but then those doctors have to leave. So you're able to provide an ongoing service, which is incredible. I did see a statistic in the BBC News recently where they said that in Nigeria at the moment, every 7 minutes, a woman is dying in childbirth, which seems like a real tragedy when you consider that in many parts of the world, that just would never be tolerated. So I know that the Congo is not probably very far behind, in those statistics. I know statistics can be deceptive, but just the idea that it is so common. But you're saying as well, there's an education process that has to happen at the community level for people to understand that it is not these women's fault, it is not witchcraft, that this is something that you're having to actually send people into the villages to make sure people understand what this is because they don't even know what it is. Would you say that's fair?
Yes, yes, and that is what we are working on.
And how do you address that? Do these survivor ambassadors, is it easier for them to go into the villages and to help spread the word?
We are working on awareness, because we want to increase awareness about obstetric fistula, and we have to go to the community to organize outreaches so that the community can understand what is obstetric fistula, because most of them, they don't know about fistula.
Mm. What for people who might hear this, what can be done to support and help your center and other places that are working on fistula? What can people do?
Yes, currently people should support the sensitization and mobilization first, so that we do radio talks, we do a TV show about fistula, and we can do sports, radio sports, and we just print flyers, we print roll up, and we go to the churches, and we go in different facilities, because even doctors, nurses, they don't know much about fistula and how to make a diagnosis of fistula. So that we go through the community and we train midwives, we train doctors, so that we can prevent the disease, because the fistula can happen at all the levels. In the community level, the people who deliver from home, that is the place we can sensitize to prevent. Another level is at the hospital. Some patients, they reach to the hospital, but they don't get the good care from the midwives. The midwives will not take the right decision, and at the end, they will cause fistula. And at another level is at the doctor's level. Some doctors, they do cesarean section in a wrong way, and they made a mistake, and still the patient, they end up with fistula, because currently we are getting big numbers of iatrogenic fistula, the fistula caused by doctors, so that we have to prevent at all the levels, so that we do prevention at the community level, we do prevention at the hospital level, and that side we just categorize in two groups. The first group, we train midwives, and the second group, we train doctors how to do safe cesarean section. And I think if we start with those two, but we have to see also the reintegration aspect, because most of them, because we can treat well the fistula, we can prevent fistula, but those victims who have got fistula already, we have to reintegrate them and accompany them and teach them how to do some small jobs so that they can be independent, because that one even will reduce the poverty to get more fistula. If the woman has something like little money, and she will be able to access the obstetric care, safe obstetric care, and she can go to the hospital and deliver and pay her own money to deliver safely. But if she doesn't have money, she doesn't have anything, she will continue delivering from home. So that we have to prevent also the fistula at that aspect. So that prevention is key, and prevention should go with awareness, because the community does not know about fistula. So that we raise awareness, and at that time we will prevent. And we have to train midwives and doctors.
I know that for some people who are listening to this or maybe don't know a lot about the history of fistula, fistula was an issue in Ireland, in Europe, in America, in the United States, and it's been an issue in parts of the world, and it is no longer an issue. So I do feel that even though it is difficult and it is challenging, it is possible for us to change fistula, don't you think? If we work at the prevention and the treatment and the rehabilitation, it is possible for us to change this for women there. Do you think?
Yes, I have hope, because everything is about the sensitization. Because fistula has been eradicated in developed world. In Ireland or in Europe, we have no fistula. And if they get iatrogenic fistula, the fistula is treated immediately at the hospital. So that we have no fistula in Europe in the community. We may have some iatrogenic fistula in the hospitals, but they don't come out from the hospital with fistula, which is the other way around in DRC or in Africa. We get fistula in the community. We discharge patients with fistula, they go back home. And when they come back to the hospital, we send them back home. Even if they have money, we try to repair, but it does not succeed. We repair 3, 4, 5, even 10 times, and we destroy all the tissues. And at the end, they remain with fistula for their entire life, and they become miserable. And we end up doing the derivation. So that diversion, we end up doing a diversion, so that we put the urinary system into the digestive system. So that is now the the operation we end up doing, because the tissues have been destroyed. So that to prevent all this, we have to train doctors so that fistula can be treated in all the facilities. And that is our goal, to train more doctors so that every hospital should be able to treat a fistula case. And still, to prevent, so that in all the maternities, in all the labor suits, the midwives should be able to take the right decision for the woman. Because here in Africa, to deliver via cesarean section, it seems to be that you have failed. You have delivered wrongly. You didn't deliver well. And they always say that, and even midwives, they just tell the women that you have to deliver by uh, normal delivery. You don't need to deliver by C-section. So that they end up creating more injuries to women, because they are not aware that even cesarean section is also a way of delivery. So that we have to work on all those by explaining to people, the community, and even the midwives that cesarean section is also a way of delivery. And still, that cesarean section should be a safe cesarean section. It should be done well, because you may indicate a cesarean section and still the doctor will create a fistula. And still that doctor, if he creates a fistula, should be able to repair this fistula. So that if they are not able to repair fistula and they send fistulas in the community, we will just keep having the same cycles, creating fistula, and still not treating fistula, and we'll get more patients of fistula. But if we work as a team, we prevent this, I think we'll get the better result in the next 5 to 10 years. We'll have a world without fistula, as it has become in Europe. Because if Europe is able to eradicate fistula, why not at our level? And still, our level, if we have to eradicate this, we have to work hard and work on that and train more people, and we prevent so that we can reach at that level. So that for us, we have given ourselves our mission to eradicate this, to prevent and to treat fistula, and to train and to do rehabilitation. So that we are working on this, and we've trained many people to do this, because one person cannot be able to do this. That is even why we're having a big team which is well trained to be able to do all this to prevent fistula. And we are very sure if we get support and we get more people on board to work with us as a team, and within the 5-10 days, you'll get a result. Because with just the few years who have been here, ourselves, we can just feel that we are doing more effort and we can see a change. And we are getting more patients who have been suffering for many years, but they are getting better, and they are the one now helping us to get other patients. And that is just like the beginning, and we hope to move forward so that we can get more people on board and we can help more women.
Thank you so much. What you're doing is incredible, and we are so grateful to have you and everything you're doing. And I know that Maura Lynch would be so proud of you, and the MMMs support you, and the Safe Birth for All Coalition as well. And we are fortunate to have doctors like Shane Duffy as well, who are also performing surgeries and training doctors as well. And we will do everything that we can to support you and to help you with your mission. Just so people have an understanding of this, what is the kind of cost of an obstetric fistula surgery? I know you can't give an exact number, but around what cost would it be if someone did want to donate and support a surgery? What kind of cost are we talking about?
Actually, according to the different studies, only surgery, it costs up to $600. Only
Right.
surgery. But if you end up with a sensitization, prevention, rehabilitation, you have to go up to $1,000 per patient to help a woman who has lost hope. She will be treated for free, and rehabilitation will be done, and she will be able to be independent, and she can be able to get her own money after treatment, and she can prevent to deliver from home by going to the hospital and pay herself the care, and so that she can deliver in the good condition, because poverty is also among the key causes of obstetric fistula in DRC.
It does seem an injustice that because a woman is born in a richer area or born to a richer family, that she would not have to experience this in certain parts of the world. So there does seem an injustice area to this as well, doesn't there?
Yeah, this is injustice. That is why even right now we are promoting the right to these women, because no one is talking about them, and everyone is ignoring their suffering. They are suffering a lot, and everyone is ignoring them in the community. and they have been stigmatized, rejected, so that we have to do our best to work as a team for their rights, so that they can just live their life, because they did nothing. They wanted to give a new life. And at the end, they end up in trouble. They will be rejected, stigmatized, and they will be accused that they are doing witchcraft. And they will be traumatized for their entire life, because no one can understand how they can leak urine, how they can smell urine, and they will accept that they are witches, and they are doing witchcraft, and they will accept it because the community has decided to tell them that that should be the right thing. So that this is injustice, so that we have to work hard to help them. Yeah.
Thank you so much for your time and for sharing your information. We will be sure to share your contact information with people who listen to this. So thank you again for all your work. Congratulations to you and your team for such an incredible accomplishment there, and offering a light of hope for people. So thank you so much.
Thank you. Thank you very much. Thank you so much for your support. Thank you.